Assalamualaikum and hi everyone. My name is Rabi'atul Adawiyah binti Mohamad Khalib and today I will be presenting about drug and food interaction between calcium channel blockers, specifically amlodipine and nifedipine, and grapefruit juice. So, let's get started. Did you know that the food you eat can interfere with the medication you take? Drug-food interactions happen when something you eat or drink affects the way a medicine works in your body. These interactions can make a drug stronger or weaker than intended. Sometimes, they can even cause unwanted side effects or reduce the drug effectiveness. That's why pharmacies and healthcare providers always ask about your diet. It helps them make sure your medications work the way they are supposed to. Let's break it down in a simple way using ADME, which stands for absorption, distribution, metabolism, and excretion. Absorption. How will the medicine get in? Food can slow down, speed up, or reduce how much of the drug gets absorbed into your bloodstream. Distribution. Where will the medicine go? After a drug is absorbed, food components like fat or protein can affect how the drug travels in your body and how much of it reaches the target area. Metabolism. How is the medicine broken down? Some foods can increase or block the enzymes that break down drugs in the liver. These can lead to either too little or too much of the drug in the body. Excretion. How does the medicine leave the body? Food and fluid intake can influence how fast or slow a drug is removed through the kidneys or intestines. So, in short, food can change how a drug behaves in your body, either making it work better, worse, or last longer than expected. That's why understanding drug-food interactions is important in pharmacotherapy. Next, let's explore the mechanism of interaction between calcium channel blockers, amlodipine and nifedipine, and grapefruit juice. Drugs like amlodipine and nifedipine are usually broken down in the liver by an enzyme called CYP3A4. Grapefruit contains natural compounds called furanocoumarins, which block the action of CYP3A4 in the small intestine. When this enzyme is blocked, less of the drug is broken down before it enters the bloodstream. As a result, more of the drug enters the bloodstream at higher levels than intended. This can make the drug work too strongly and increase the risk of side effects like dizziness, facial flushing, or dangerously low blood pressure. So, even though grapefruit is a healthy fruit, it can interfere with how these medications are processed in the body, making them potentially harmful. Now, let's take a closer look at how grapefruit juice affects the drug's pharmacokinetics, specifically through the ADME process: absorption, distribution, metabolism, and excretion. Let's start with A, absorption. Grapefruit juice affects how some drugs are absorbed in our body, especially drugs like calcium channel blockers. Here's how. Grapefruit juice contains compounds that block an important enzyme called CYP3A4, which is found in the lining of the small intestine. Normally, this enzyme helps break down drugs before they enter the bloodstream. But when CYP3A4 is blocked, less of the drug is broken down. This means more of the drug is absorbed into the bloodstream than expected, leading to high drug levels in the body, which can increase the risk of side effects. Now, let's move on to D, distribution. After absorption, the drug is distributed through the bloodstream to different parts of the body. Grapefruit juice can increase drug levels in the blood, which affects how the drug is distributed. This can cause too much of the drug to reach certain organs, like the heart or the brain. As a result, this unbalanced distribution can lead to stronger effects or side effects, such as dizziness or low blood pressure. Next is M, metabolism. Normally, drugs are broken down in the liver by enzymes like CYP3A4. But grapefruit juice blocks this enzyme from working properly. As a result, less of the drug is broken down.
This means more of the drug stays in your body for a longer time, which can lead to stronger effects or a higher risk of side effects. Finally, E stands for excretion. After the drug is broken down, it needs to be removed from the body. This usually happens through the kidneys as urine or through the liver as bile and feces. But here is the problem. If the drug isn't properly metabolized due to grapefruit juice, it can also cause slower excretion. As a result, drug can build up, causing it to lead to stronger or longer effects.
As we have seen, grapefruit juice can affect every part of the acne process, changing how the drug is absorbed, distributed, metabolized, and excreted. All of these changes can influence how the drug works in the body and how safe it is.
Next, let's proceed with clinical consequences. So, what actually happens when grapefruit juice interacts with calcium channel blockers? Grapefruit juice blocks an important enzyme in the body called CYP3A4. This enzyme normally helps to break down certain medication, including calcium channel blockers. When grapefruit blocks CYP3A4, less of the drug is broken down, meaning more of the drug enters the bloodstream. As a result, there's too much drug in the body, which can lead to stronger effects than expected. This can cause several adverse effects, such as dizziness, lightheadedness, nausea, facial flushing, headaches, and even hypotension or low blood pressure. These side effects can be uncomfortable and in some cases potentially dangerous. There's even a real case reported by Poison Control. A 50-year-old woman was taking amlodipine, atenolol, and clonidine for hypertension. She drank 6 to 8 ounces of grapefruit juice with every meal for 2 days. On the third day, she felt lightheaded, dizzy, and nauseous. The grapefruit juice had interacted with her amlodipine, causing her blood pressure to drop too low. After stopping the juice, her symptoms resolved within 3 days.
These highlight how even a common fruit like grapefruit can have serious consequences when combined with certain medication. That's why it is best to avoid grapefruit juice while on this medication. If you are unsure, always ask your pharmacist. We are here to help. Hi, I see you are taking amlodipine to help manage your blood pressure. That's great, but I'd like to remind you of something important about your diet. Please avoid grapefruit juice while you are on this medication. It can affect how the medicine works in your body. If you enjoy grapefruit juice, no worries. You can always switch to apple juice, orange juice, or even plain water. Also, remember to check labels on mixed fruit, drinks, or snacks, because sometimes grapefruit is added without you even notice. If grapefruit is something you usually consume, it is a good idea to talk to your doctor. They might consider switching you to a different medicine like atenolol or lisinopril, which don't interact with grapefruit. Also, while taking amlodipine, it is important to monitor how you are feeling. If you feel dizzy, tired, or faint, please tell your doctor or pharmacist right away. And most importantly, don't change your dose on your own. Always follow your doctor's instruction. If you are not sure about anything, just ask. We are here to help you to stay healthy. What did we learn today? Food might seem simple, but when it comes to medication, it can change literally everything. Just one glass of grapefruit juice can make a medicine too strong, too weak, or even dangerous. That's why we, as future healthcare providers, always ask about your diet. It is not just a small talk, because what our patients eat and drink can affect their treatment. Understanding drug-food interaction isn't just science, it is how we save lives, improve health, and make medicine work the way it should. Thank you for listening, and remember, always double check before mixing meds with meals, because in pharmacy, every details matter.